If you have rheumatoid arthritis, there's a hidden risk that could threaten your heart and your life. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My mission is to help you live pain-free and reduce long-term risks so you can stay active and well for years to come. Most people think rheumatoid arthritis only affects the joints, but that's just one part of the story. We now know that RA causes widespread inflammation that can also affect your heart, blood vessels, and metabolism, dramatically increasing your risk for heart attacks, strokes, and cardiovascular death. Whether you're newly diagnosed or have had RA for years, this hidden risk can potentially affect you. But here's the good news. With the right treatment plan and lifestyle changes, you can dramatically reduce your risk. Today we'll cover what the research shows about RA and heart disease, why inflammation affects your heart, how RA medications impact your cardiovascular health, and what lifestyle changes can help protect you. Rheumatoid arthritis is a systemic autoimmune disease. That means your immune system isn't just attacking your joints, it's producing inflammation that can affect your entire body, including the cardiovascular system. That inflammation damages the endothelium, the lining of your blood vessels, and accelerates atherosclerosis, the buildup of plaque that leads to heart attacks and strokes. A study in Circulation showed people with RA have a 60% higher risk of cardiovascular disease. A 2021 meta-analysis in RMD Open found a 1.5 to 2 times increase in the risk of heart attack, stroke, and cardiovascular death in RA patients, even when accounting for traditional risk factors. This is the same level of risk we see in people with type 2 diabetes. RA affects women more than men, 2 to 3 times more often. And unfortunately, women often have more severe inflammation and greater cardiovascular risk. The Nurses' Health Study, which followed over 100,000 women, found a significantly higher risk of heart attack in women with RA, even after controlling for smoking and cholesterol. And traditional heart risk calculators often underestimate risk in women with autoimmune conditions. After menopause, this risk increases further due to hormonal changes and rising inflammatory markers. The symptoms of heart disease and RA can be subtle or confusing. You might notice shortness of breath with light activity, unusual fatigue that doesn't feel like a joint flare, mild chest pressure or discomfort, upper back or jaw pain. These are signs that your heart may be under stress, even without classic chest pain. If you have RA and something feels off, get it checked out. Some RA medications reduce cardiovascular risk because they lower systemic inflammation. Methotrexate. Studies show that methotrexate reduces heart attack and stroke risk by up to 21%. It's one of the few medications proven to lower both joint damage and vascular inflammation. TNF inhibitors. These include medications like Enbrel, Humira, and other TNF blockers. A study from the Corona Registry found that TNF inhibitors cut the risk of heart attacks by 30% in RA patients. Interleukin-6 inhibitors, such as Actemra. IL-6 plays a key role in RA inflammation and cardiovascular disease. Tocilizumab lowers both joint inflammation and CRP, a key heart risk marker. IL-6 and IL-1 blockers are even being studied in people with heart disease who do not have RA because of their anti-inflammatory effects on blood vessels. On the other hand, long-term steroid use can increase your cardiovascular risk. While corticosteroids like prednisone are helpful short-term, they raise blood pressure and blood sugar, increase cholesterol and central obesity, and promote insulin resistance. The BSR Biologics Registry showed long-term steroid users had more cardiovascular events. The key takeaway here, use steroids sparingly, focus on disease-modifying and biologic treatments that control inflammation without metabolic side effects. Inflammation is not only about medication. Lifestyle plays a huge role. You want to control inflammation first, whether through medication or other means. Controlling RA disease activity is the foundation of heart protection. You want to eat for inflammation reduction. Follow a Mediterranean-style diet. Vegetables, olive oil, fatty fish, legumes, nuts, emphasize those. On the other hand, you want to limit red meat, refined carbs, and processed food. This diet lowers inflammation and reduces cardiovascular events even in people without RA. Weight loss is also important. Weight loss equals lower risk for heart disease. Weight loss is a powerful anti-inflammatory tool. A 2020 study in arthritis care and research showed that losing 5 to 10% of body weight in RA patients reduced joint inflammation and improved cardiovascular markers. Excess weight increases systemic inflammation, CRP levels, and insulin resistance, all factors that raise cardiovascular risk. You want to focus on sustainable, gradual weight loss through nutrient-dense meals, portion control, movement and strength building, and remain consistent over time and understand that consistency over perfection is key here. The next key step is to move your body. Exercise improves cardiovascular health and reduces joint pain when done properly. You want to aim for 30 minutes of walking or low-impact exercise 5 times per week. Light strength training or resistance bands, flexibility work to support joints, even small improvements in fitness can lower your C-reactive protein and cardiovascular risk. Sleep, stress, and smoking are also key. You want to prioritize 7 to 8 hours of sleep per night. Manage stress with breath work, therapy, mindfulness, prayer. And if you smoke, quitting may reduce your RA severity and heart risk almost immediately. Talk to your doctor about the following important tools when it comes to labs and screening. Here's what you need to ask for. Your CRP, it's a measure of low-level inflammation linked to heart risk. Lipoprotein A and homocysteine are genetic and vascular risk markers. A coronary calcium score or carotid ultrasound to look for early detection of plaque buildup. These tests go beyond cholesterol and can help you catch problems early. So let's wrap up. RA increases your risk of heart disease significantly, even early in the disease. Women with RA face unique risks that are often underestimated. Some RA medications, especially methotrexate and biologics, can lower heart risk. Steroids should be minimized to reduce metabolic and vascular harm. Lifestyle changes are powerful, including nutrition, exercise, weight loss, sleep, stress, and smoking cessation all matter. Don't rely on standard cholesterol tests alone. Ask for better cardiovascular screening. And you have more control than you may think. The key is to act early, stay consistent, and work with the care team that sees the full picture. If you found this helpful, please make sure to like, subscribe, and visit us at chicagoarthritis.com for more guidance on reducing inflammation and staying healthy. And if you want a personalized plan to reduce your RA and cardiovascular risk, reach out to schedule a consultation. Thank you for watching and live well.